Society.
Hello, this is Louise. I'm with Candace, the home hemodialysis nurse. She has experience both in clinic hemodialysis and then training people to do home hemodialysis.
Aloha, Louise. Yeah, my name is Candice. I've been a home hemodialysis nurse for about a year, but prior to that, I worked in the chronic in-center dialysis centers for about 5 years. So I can have a good understanding of the difference of how the patients feel between the chronic in-center hemodialysis versus home hemodialysis.
Nice.
So with home hemodialysis, the benefits are that they can do it at the convenience of their own time and not at the clinic's convenience. They dialyze anywhere between 4, 5, 6 days and even overnight nocturnally. So it's less stress on the heart. And those are like the main benefits of home hemodialysis. And overall, they're better like quality of life. They have time to um, go out and do all the activities that you know they wouldn't be able to because they're stuck on like a in-center dialysis schedule. And usually when they're in chronic hemodialysis centers, sometimes they'll feel more like hypotension, cramping. They're just removing too much fluid too fast. So with the next stage or home hemodialysis, both of the terms are used interchangeably. It's overall the patients feel a lot more better. Their fluids are pulling at a slower rate, so they won't get all these side effects such as like hypotension and cramping. And their recovery time is also faster for their body as well. They won't feel like more drained or fatigued at the end of their treatments.
So in the clinic
Yeah.
hemodialysis, there are nurses and technically trained people to
Yes.
keep track of the machines and the process and the well-being of the
Hmm.
person.
Yes.
So it sounds like the person who does home hemodialysis needs to take on all that responsibility themselves.
Yes, that's correct. So we thoroughly train our patients and their care partner for about anywhere between 3 to 5 weeks, Monday through Friday, for about 4 or 5 hours. So we'll teach them everything from the setting up their versicycler, how to they'll even have like a pre-lined we call it a cartridge. It's already pre-lined with the lines and dialyzer. We'll teach them how to do that setup, and then we'll teach them how to do their pure flow or their water system setup as well, and also troubleshooting for any medical or technical difficulties. And we also have like a 24-hour nurse on call for any medical problems. And then we also have our 24/7 technical support with Next Stage. So they can help them troubleshoot through any alarms or any problems with the equipment. So we train them very thoroughly, make sure that they feel safe and confident. And in the end, it's when they're in control of their own treatment, then it's better results for them as well because they're aware of like how much fluids, they're removing, and in return, it's like they'll restrict their fluids because they know how they feel if they're pulling out too much, and just to be more independent and accountable and just in charge of their care and their health. And then they'll really get like beautiful lab results, and like their quality of life is just so much better, and they're so much happier on this modality as well.
So you mentioned a helper. So must a person have someone at home who can help them with the hemodialysis?
Yes, ideally it would be really good to have a care partner, at least somebody who can is aware, how to do like any medical like emergencies, and they have somebody, who can help them if they're not feeling well. But we also have like an option where they can do this solo if the doctor approves it, then, and we deem them stable, then they can do this modality as a solo. But ideally, it would be good to have a care partner, even if it's like their other half or a partner, or
Mm-hmm.
like their mom or dad or brother, sister. At least somebody kind of knows, what's going on in the home and how to help them, and just to call for help, or, for 911 if they really do need help. But like I said, we pull like our fluids at a very slower pace. So there's less, occurrences for a lot of medical emergencies, like the hypotension or cramping, and um, because yeah, our machine is it's like more gentle on their body and their
Mhm.
heart. So
Since the fluids are pulled at a slower rate, is the total duration of each dialysis session longer for home hemodialysis?
yes, so when we first admit a patient, we'll use a system called the next stage dosing calculator to calculate their dialysis prescription based on like their height, weight, the type of access that they have, and the blood flow rate. So when we calculate that out, it'll give us a whole dosing calculator of how many times a week they would get
Mhm.
adequate cleaning. So usually in
Okay.
center, it's about they'll dialyze 3 days a week for 4 hours. On home
Mhm.
hemodialysis or next stage, they can dialyze maybe 4 days a week for 3 hours, 5 days a week for 2.5 hours on an average. And then nocturnally is overnight or how long that they sleep for about 6 to 8 hours. So it depends on what prescription will fit the patient's lifestyle better, but they will be getting more cleaning with the next stage. So some patients, yeah, they'll feel a lot better. Like their phosphorus levels will be lower. And their potassium. We're actually a little bit more lenient with their diet if their cleaning is really good. So we have to sometimes, we would take patients off like their binders or like take off them off their blood pressure pills because everything is being really controlled with
Wow,
this modality. Yeah, so it's very impressive.
that's
Yeah,
nice.
so blood pressure pills I had to stop. Even all the binders, in center, they're like putting them on different binders, adding binders. I was like, that's not, the solution. The solution is they just need more dialysis, and they can reach that with home hemodialysis. So it's been a really like beautiful process to witness, my patients and I get to see the transition
Mhm.
between, and the differences between chronic, in center and home hemodialysis. And my patients are so happy on home hemodialysis, just being in charge of their care and being like, I feel so much better. And then, it increases their chances for kidney transplant as well because all their labs are, within normal limits, all their fluids are within normal limits, and that's really good for transplant.
So that's a
We're
that's
really
a
happy.
benefit I hadn't thought of. You mentioned binders. Can you remind us what those are and why they're used?
So, phosphorus binders will help the dialysis patient remove all the phosphorus that's in the blood. So, patients will need to take phosphorus binders with their meals to remove it from their system. So, usually, um, with in-center, they're not getting enough dialysis to clean like all like the toxins and the waste out. So sometimes they would have to like add, extra phosphorus binders to remove that. But with our home hemodialysis system, they're receiving more adequate dialysis throughout the week. And so that would also help, clean the blood better. It's kind of like, you want to take a shower every day to feel clean. So right now in center, chronic hemodialysis, they're only taking a shower 3 times a week. But this modality with next stage, they can take a shower 4 times a week, 5 times a week, overnight. Overall, we are cleaning their blood, and filtering out their system better and more adequately.
I'm guessing this is a type of dialysis that's not appropriate for everyone. And I would guess some people don't want to have to stick themselves with needles or are concerned about maintaining a sterile environment at home. How do you determine who's appropriate for home hemodialysis?
That's a really good question. A lot of our patients who are on home hemodialysis, they have like the desire and want and need to, feel better and their overall quality of life. Majority of our patients, they are still working, so that is like a huge advantage to them because they can do it at
Yeah.
the convenience of, their own time and not at the clinics. And Instead of like arriving to the clinic late for their treatment because of work, or they have to cut their time or cut time from work, so they're cutting out pieces of like their life, away from their family, just to make it to treatment. With the home hemodialysis, they can do it at the convenience of their own time at work, and like still be at home and present with their family. And right now with the whole pandemic going around, it's they can get their treatment right at home in the safety of their own home. They're not exposed to everyone. So that has been a major push for home hemodialysis as well.
Yeah, that makes sense. Can
Mhm.
people start at the beginning with home hemodialysis, or do they generally start in the clinic?
Yes. So next stage, or home hemodialysis, we are a growing program. So the doctors are actually referring patients to us directly. And then we have been collaborating with the Kidney Foundation, so that they can also like monitor patients and refer them to home hemodialysis. And we also educate all the patients of all the modalities before starting. And, hopefully, that I know all the nephrologists are also, um, giving all the patients all the different options before starting, so they can choose what would, fit their lives as well. So, and I still like go into the clinics and orient the patients and share about next stage and home hemodialysis. And I just let them know, like, in center doesn't have to be your only option. Like there, everything we do in the center, we can now do in the comfort of your own home. So a lot of patients have been very happy, whoever, tried tried home hemodialysis.
You mentioned training briefly. Can you tell me in more detail how long it is, what's involved in it, when patients leave training and start doing their dialysis at home for the first time?
Yes, so patients and their care partners, they usually train for about 3 to 5 weeks on an average, Monday through Friday for about 4 to 5 hours. So they'll get their dialysis and their training at the clinic as well. We'll teach them everything from setting up their machine, troubleshooting, documentation, how to troubleshoot. Of course, all the cannulation, troubleshooting with their access, medical emergencies, technical difficulties, and um, yeah, just how to be very safe. And some patients, they're like, okay, they just want to go home, like they want to leave me within maybe like 3 weeks, like their whole life can change and they can be in the comfort of their own home. So
You
yeah.
mentioned that a lot of the patients are still working. Do they have to take a month off from work for the training, and their partner?
Yes, so that's a really good question. Some of our patients, they will take off from work, or they would move their work schedule around, either in the morning or afternoon. And then their care partners, they can probably train with us for at least like 3 or 4 times, just to show them what to do in case of an emergency. But usually, you know, the patient will be the primary person to like, set up the machine, break down everything, understand the whole process of the hemodialysis, and then the care partner would come in for like the troubleshooting, medical emergency portion of the training.
Okay. And do people get into training and then either the patient or the caregiver decide this is not something they want to do?
Yes, we did have patients and their care partners who have decided that home hemodialysis is not a good option for them at home. It's most likely due to like patient or caregiver burnout. Like when you calculate all the time and everything, they do see that the time is equivalent to them being in center. So, like I said, in center, they're about maybe on an average 3 times a week for uh, 4 hours. To set up the cycler, it takes 23 minutes to prime the machine. And then to gather the supplies, get their access ready. So that's already 1 hour. Plus, they'll do their dialysis, which is another 2.5 to 3 hours. And then another maybe half an hour for breakdown. and to clean, disinfect. And so when they add it up, they're, some patients and their care partners is like, it's kind of equivalent to being in center. But now I have to do everything. But the end result is that they do want to live like a better, quality of life, be in the comfort of their own home with their loved ones. And
Right.
yeah, and they'll their body feels they can feel their body feeling better,
Good.
and their labs are beautiful, and overall they just, they're like, my body isn't so tired, I can sleep better at night, I have my appetite back. And and their care partners are like, I have my husband back, I have my wife back, like they can do your dialysis, and they have energy now, like they don't feel tired and fatigued, and they have to sleep all day. So it's really, really nice to hear that,
It
and
sounds
how
like there
happy
are a
the
lot of
patients are.
benefits. Besides the requirements for running the dialysis itself, what are the requirements for the house? What other things do you need to make sure you have to do home hemodialysis?
Yes. So initially we'll do a home assessment. So the nurse and our biomed technician, we would go into the house and do an overall inspection of the house. So for our cycler and our pure flow, we just need two outlets to plug these in. And then we'll send a plumber to do an attachment to the bottom of their sink, one for the water line and one for the drain line. So um, wherever they want to dialyze, if it's in their room or their bedroom, it just has to be within like 20 feet of a sink. And
So
then,
tell me more about the sink. So are there drain lines from the machine to the sink?
yes. So there for our pure flow, you'll need one connection for the city water, and then it'll come and fill up a pre-filled bag. We call it dialysate. It's filled with electrolytes, and that will go through a bunch of filters, a purifying pack, and then it'll make um, a huge like dialysate bag, maybe of like 30, 40, 50, or 60 liters of dialysate that will clean their blood. And then when they're on treatment, we'll have the drain line where all the toxins will go down the drain. So we'll send a plumber
Okay.
to do that water connection hookup.
Now might be a good time for you to walk through the, the setup process
The setup process.
and exactly what a person is doing when they do a dialysis session.
Okay. Um, Let me grab some tools real quick.
Okay.